Every 2 minutes, a woman dies of cervical cancer. We are losing women in the prime of their lives. They are mothers, sisters, daughters, aunts, and friends. Cervical cancer is a silent killer, often with no symptoms. Screening and treatment is the only way to prevent it from claiming a woman's life. With early vaccination and routine screening, cervical cancer is nearly 100% preventable. 99% of cervical cancer is caused by the human papillomavirus, or HPV, the most common sexually transmitted disease in the world. But HPV can take decades to progress to cervical cancer, thus giving us multiple opportunities to catch and treat abnormalities before they become cancerous. We have the tools, we have the knowledge to eradicate cervical cancer so no woman should die of this preventable disease. An overwhelming 90% of cervical cancer deaths occur in resource-poor countries where women lack access to basic care. The darker colors on this map illustrate that disparity, showing the disproportionate incident rates for cervical cancer. And these are the places that Cure Cervical Cancer works. Hello, my name is Dr. Patricia Gordon. I had the privilege and honor of founding Cure Cervical Cancer in 2011. It is dedicated to the early detection and prevention of cervical cancer around the globe for the women who need it most. Cure Cervical Cancer operates on a 3-part sustainable model. First, we establish a clinic. We find the highest need communities and provide them with the necessary supplies to screen and treat for cervical cancer. Our clinic in a suitcase model has all of the components of See and Treat clinic, which can be packed in a standard suitcase and transported to even the most remote regions of the world. So what is See and Treat? See refers to using vinegar, which we spray on the cervix to screen for cervical precancer. If precancer is found, it is treated on the spot with either non-invasive thermal ablation or non-invasive cryotherapy. It is painless yet effective, and it stops the progression of cervical cancer in its tracks. Cure Cervical Cancer has brought this life-saving care to women around the world by establishing over 100 sustainable See and Treat clinics. The next part of our sustainable model is education. Cure Cervical Cancer conducts specialized hands-on training for local healthcare professionals to learn the See and Treat method, so they can continue to provide this life-saving preventative care in their communities. We also train community health workers to educate men and women in their local communities about cervical cancer and to help us mobilize the women into our clinics. The final part of our sustainable model is empowerment. One of the keys to making our clinics sustainable is establishing partnerships on the ground with local organizations who are passionate about the mission of eradicating cervical cancer in their local communities. These partnerships help ensure that our clinics can continue to screen and treat hundreds, if not thousands, of vulnerable women each month, long after our team leaves the region. How have we adapted this model to COVID-19? Cure Cervical Cancer has responded by collaborating with our ground partners to continue providing screening and treatment services in a safe, COVID-conscious way. We supported our clinics around the globe by funding PPE for healthcare professionals and patients and adapting clinic services and community outreaches to comply with social distance guidelines and other best practices. One of our partners in Kisumu, Kenya, even recruited tailors to sew reusable face masks. Even in the face of this global pandemic, We have not stopped providing life-saving care. We are losing women around the world to a disease that we have the knowledge and the tools to prevent. What can you do? Go to our website, curecervicalcancer.org, to get more information on how you can support Cure Cervical Cancer's crucial work and get involved in the fight to end cervical cancer. Together, we can open the door to a world where no women are lost to this 100% preventable disease.